Hi, I'm Tom Mansfield. I'll be discussing how to use the T5 system to accelerate patient flow and improve patient care by increasing efficiency. This is the overview or the big picture view of the whole process from patient's arrival to the patient's leaving. This video takes about 20 minutes. It shows how these three components work so well together. Forward deployment of resources, T5EV charting system, and tablet computers. Forward deployment of resources is also called team triage and treatment, or T3. This is the essential part of the efficiency, positioning whatever resources are needed right at the registration area so the senior physician can see the patient without delays and start treatment sooner. The old school emergency department process did everything in serial mode, where the second step can't start until after the first step is completed. The new T5 process works in parallel mode, where multiple steps are started at the same time. T SystemEV charting and tablet computers enable the rapid and efficient forward deployment of resources. That is, they enable all the members of the team to triage and treat the patient quickly and efficiently. I will walk you through the experience that a typical emergency department customer will have when the T5 system is in use. In subsequent videos, I will go into more detail about the theory of forward deployment of resources, screenshots showing T SystemEV's design and how it allows for fast charting and ordering, and how a tablet computer frees you up and untethers you from the desktop computer, for all of you who have not already experienced this with your own tablet computer. In this video, I will show the experience of two specific patients. One, a patient that is seen and discharged from the T5 area, which is typically about 34% of patients, and two, a patient that is seen in the T5 area, has their initial evaluation, labs, meds, radiology ordered, and is sent to another part of the emergency department where another provider follows up with the treatment, labs, and radiology and makes the final disposition of the patient. I hope when you see the T5 system in action that you will be excited as I am that finally there's an easy, practical, and intuitive way to be much more efficient in the emergency department. The T5 system makes it easier for us to treat our patients. The patients are much happier when they don't have to wait to be seen, when treatment is started sooner and completed sooner. This really improves the whole emergency department atmosphere. Our patient, Betsy Murphy, walks into the emergency entrance, or she is wheeled in by wheelchair by the helpful attendants who are waiting outside the front entrance to help Betsy out of her vehicle so the family can park the car. Betsy sees a large sign saying emergency department patients start here, which points to the T5 area. She walks in and sits down, or she is wheeled right in, or she is put right onto a mini gurney. Registration comes to her with their computer and gets her name and birth date and either matches her from previous information in the hospital computer system or gives her a new registration number. How long does it take to register? Usually just a few minutes, and Betsy will get into the T SystemEV. Now everything else can start. Any further paperwork, signatures, insurance verification, and copying can be done then or later when time permits, either at the patient's bedside or at chairside or on her way out. The paperwork does not take precedent over the provider evaluating the patient. Once Betsy has a hospital number, she appears in the T SystemEV screen. However, if needed, she can be registered right in T SystemEV itself, providing an instant chart creation, and she can be registered at the same time as the processes are being done. So now chief complaint, vital signs, meds, allergies, etc. can be completed or pulled into the system from a previous ED visit and verified. You don't necessarily need an RN to complete this. An LVN or ED Tech can complete these steps. Either now or sooner, a senior emergency department physician, Dr. Gandy, greets Betsy, and he sits on a stool while he talks to Betsy. The importance of a senior emergency department physician is emphasized by Dr. Mayer and will be discussed in subsequent videos. Dr. Gandy uses a tablet computer just like we used to use a paper chart on a clipboard, except the tablet is being updated instantaneously, and Betsy's old ED visits are immediately visible and available to Dr. Gandy right while he's sitting on the stool. Dr. Gandy doesn't need to review these before he goes to see Betsy. He can review them with her and discuss and comment on them with Betsy. Oh, I see you had a UTI treated with Cipro 6 months ago. Does this feel like the same symptoms? Did that clear up quickly? Or, oh, I see last year you had a bad cough and turned out to be pneumonia and you had to be admitted to the hospital. We had better get an x-ray to see if your cough has progressed to pneumonia again. Many times we have looked at previous charts before we go in to see the patient, and our patients often have no idea that we have spent the time being thorough in evaluating them. When we do it in front of them, they see our thoroughness, and often it's faster as we're not being constantly interrupted, or don't forget everything by the time we actually see the patient. Dr. Gandy charts the history now, performs a physical exam, and charts it all right there in front of Betsy. Now there are 4 possible next steps. If Betsy has 1, a simple problem which can be discharged right from the T5 area, and the Aftercare prescription shown to Betsy and printed right in the T5 area, or 2, if she has a simple problem that only needs a quick lab or procedure, for example, a quick strep or urinalysis, IND, dermabond, simple suture, or x-ray, that can be performed in the T5 area or an adjacent 10-minute procedure room, and then Betsy can be discharged from the T5 area or this procedure room. Or 3, if she has a more significant problem where meds, labs, radiology are ordered by Dr. Gandy and started by the RN, and then Betsy is sent to a regular bed in the emergency department area. Or 4, if Betsy was an ambulance patient. Ambulance patients are T5'd using the tablet wherever they are, right on the ambulance gurney, and then sent to either a critical care area or another bed or a chair. And the labs, meds, x-rays can be ordered right then and there also. If Betsy has a simple problem, for example, an otitis or bronchitis, pharyngitis, laryngitis, medication refill, torticollis, she can be discharged right from the T5 area. While still sitting on the stool, Dr. Gandy taps out the diagnosis, the Aftercare and prescription, and then using his tablet he shows and explains the Aftercare and prescription to Betsy, then taps print for the Aftercare and electronically sends the prescription to Betsy's pharmacy or prints it out and signs it. And then Dr. Gandy asks Betsy if she has any further questions. If not, he shows Betsy to the printer area, and the ED Tech gives Betsy her printed instruction that Dr. Gandy had already shown her on the tablet computer screen. And Betsy leaves. Dr. Gandy then looks at the status board on his tablet screen, taps to select his next patient, and walks right over to the next patient without having to go back to his desk. How long do you think it took Betsy to be seen and leave? Probably under 30 minutes. Do you think Betsy is satisfied and pleasantly surprised with her emergency department visit? Now, I'm sure you may be saying you can't chart at the bedside and you can't complete the chart in 3 minutes. Well, forget everything that you know and hate about computerized charting. The T SystemEV video will convince you that you can chart on a tablet computer right there in front of Betsy, that is, at the point of care. You don't need a scribe to keep up, and you won't have to customize the T SystemEV for it to work. Your completed chart will be vastly superior with far less effort. Prepare to be amazed when you see the T SystemEV in action, and prepare to try to keep from swearing at your present charting system. Number 2, If Betsy has a simple problem but needs a quick strap or urinalysis, HCG, dermabond or sutures, simple IND or pelvic exam, or simple x-ray, then, while still sitting on the stool, Dr. Gandy taps out the orders and returns to show Betsy the results a few minutes later after they are completed. Many times the RN in the T5 area has already completed a quick strap, urinalysis, HCG, or the x-ray before Dr. Gandy saw the patient, so there would be no delay, and Dr. Gandy would be able to complete the discharge right then. If it were a quick procedure or a breast or genital exam, Betsy would be taken to an exam room or a 10-minute procedure room. The 10-minute procedure room nurse would have everything all set up for Dr. Gandy. Dr. Gandy would complete the procedure and discharge her right from the 10-minute procedure room. While right with Betsy, Dr. Gandy taps out the diagnosis, Aftercare, prescription, and then using his tablet, he shows and explains the Aftercare and prescription to Betsy, asks her if she has any further questions, and then taps print for Aftercare. Dr. Gandy electronically sends the prescription to Betsy's pharmacy or prints and signs the prescription, and Betsy leaves. How long do you think it took for Betsy to be seen and leave? Maybe 30 to 45 minutes. Do you think Betsy is satisfied and pleasantly surprised with her emergency department visit? Number 3, if Betsy has significant abdominal pain and will need medication, labs, radiology, then Dr. Gandy still sees her in the T5 area and examines her right there, or in an adjacent exam room or on a mini gurney. Then Dr. Gandy is able to quickly chart the history, physical, and then discusses with Betsy what conditions may be causing her pain, then shows Betsy on the tablet computer that he is ordering blood, urine, labs, IV fluids, IV pain meds, ultrasound, or CAT scan, and the reasons for the test. Dr. Gandy explains that these will be started right there in the T5 area, but then she will be moved to a gurney in another area, and one of the other excellent emergency department physicians will meet her there, keep her informed on the lab and radiology results, give her any additional medications if needed, and recheck her and give her the results after the tests are completed. Dr. Gandy can tap, type, write out with handwriting recognition, or dictate with voice recognition a note for the physician who will continue the care of Betsy. For instance, biliary colic, known gallstones, labs ordered, pain meds ordered, expect discharge if labs okay and pain relief with meds. Patient have a primary care physician for follow-up. Or patient looks ill, expect admission and surgical evaluation after CT and labs. The T5 nurses start the IV, draw blood, obtain urine, administer IVs, pain meds, and antiemetics, and take Betsy to the other ED area and introduce her to the nurse that will take care of her in that area. Since the T5 EV system is equally fast for the nurses to chart on, the T5 area nurse finishes her charting as she hands off Betsy to her new nurse. Since physician and nurse charting is immediately updated, the new nurse caring for Betsy also can see Dr. Gandy's history, physical, and plan. The new physician, Dr. Jacobson, notices a new patient in his area when he looks at the status board on his tablet or the wall monitor and goes into Betsy's new room, introduces himself, gives her his business card, sits on the stool, and reviews Dr. Gandy's history, physical, labs, radiology orders, med orders, and verifies the history and physical, and then tells Betsy that he expects all testing will take approximately 1.5 hours and he will return with the results, but if she needs anything before then, to have the nurse notify him. When the labs and radiology are all finished, Dr. Jacobson returns to Betsy. On his tablet, he shows her the lab results and the X-ray or ultrasound or CAT scan right on his tablet computer. He explains the diagnosis and treatment and either discharges her or admits her. Note that if Dr. Jacobson was not able to see Betsy right away, her orders are already being done and her pain medication has already been given. So she doesn't really need to see him for some time if he's caught up with other patients. However, also note that it makes it easy for Dr. Jacobson to see her impromptu. He carries his tablet with him, which is just like having a clipboard with Betsy's chart on it. So with a few taps, he can bring up her chart on the tablet computer screen, quickly browse the information enough to drop in to introduce himself, give her his business card and tell her he is watching for her test results to return, then he'll be back. But if she needs anything before them, have the nurse call him. Tablet computers can help shorten Betsy's perception of waiting time. An hour or two for us speeds by, but for Betsy and her family it seems like much, much longer. Because the tablet is constantly being updated with lab results and completion time for X-rays and CAT scans, then by looking at the status board on his tablet or the wall monitors, Dr. Jacobson can immediately see what is not completed yet. Of course, the unit secretary is also constantly checking the status board to monitor any results that are not coming back in the preset time frame. T SystemEV automatically monitors and flags these discrepancies that show up on the status board. But more importantly, Dr. Jacobson is able to walk around any or all of the areas of the emergency department and make frequent rounds on all his patients. In front of them, he can pull up their chart, show them the labs that are completed, discuss the results, show them the X-ray, ultrasound, CAT scan, MRI right on the tablet. Ask if he can do anything else while they're waiting for the remaining labs or radiology, and give Betsy an updated estimated time until the completion of a remaining test. This is an example of how the T SystemEV and the tablet computer allow us to easily treat our patients as if they were our family or our friends, which should always be our goal in the emergency department. Do you think this process will increase patient satisfaction and Press Ganey scores? The tablet computer and T SystemEV make this all possible. And it's so much more efficient that it makes it easier for the physician and the nursing staff. Here's another advantage of using the T SystemEV on a tablet computer. Since the charting is easy enough to complete at the bedside, the patient is able to take a copy of the completed chart, including lab results and radiology results, with them when they leave, so they can show it to their primary care physician on their follow-up visit. You'll be amazed how concise and readable the final chart is. Most printed charts are way too verbose and long, so important information is often buried and overlooked, or the chart is too long for them to want to even read it. But not so with the T SystemEV. There are examples of this for you to see for yourself in the videos that follow this one. Also remember that our evaluation, testing, and instruction is actually a specialist consult for their primary care doctor, and having the concise, readable chart may be very helpful for them to continue Betsy's medical care, especially as many primary care physicians now are mid-level providers who may really appreciate our thoughtful, thorough evaluation and suggestions. Number 4, ambulance patients. T SystemEV and tablet computers really help here. Because you can carry your tablet with you, you can do the T5 evaluation anywhere. At the ambulance entrance, in the hallway, in the T5 area, while the patient is still on the ambulance gurney. Critical care patients, if Betsy has a significant chest pain or another emergent condition, she can go straight to the critical care area. Whether you do any charting or ordering can be tailored to how busy it is in critical care or how emergent the condition is. T SystemEV point-of-care charting and ordering on the tablet computer benefits all the other physicians in the emergency department, because this combination makes it much faster and easier to chart and order right at the bedside or anywhere. You can even switch back and forth between charting history and ordering meds, labs, and radiology, then switch back to charting more history, charting more physical, charting procedures, then ordering post-procedure radiology. You can do all this right at the bedside. No need to go back and forth to your computer workstation. Well, that's the mile-high view of the T5 system in action. Continue watching the other videos to see more detailed information. But before that, let's review the proven benefits again. Since the physician sees the patient in the T5 area and either discharges them or gets meds, labs, radiology started, the following are obvious. shorter waiting times, time to pain medication, time to completion of labs, ultrasound, CT scans, and total time in the emergency department. Also, it's obvious that there will be fewer left without being seen customers, since every patient is seen within 15 minutes. Not so obvious, though, it has been shown that fewer patient safety incidents. You can imagine that there will be no deteriorations in waiting room, and by being treated sooner, some problems will be averted before they occur. But there may be further reduction in safety incidents because of decrease in patient and staff tension. It's difficult for both sick patient waiting in the waiting room and also the staff knowing if they were that patient in the waiting room, they would really not want to be waiting so long for treatment. Patient satisfaction is increased directly from being seen on arrival, but also because it's much easier for the physician to see the patient more often, since he will also be carrying around the patient's chart. Therefore, he can look in at it with the patient without having to go back and forth to his computer workstation. Staff satisfaction increases because of the efficiency and because the patients are happier and often offer less complaints. Because T SystemEV has built-in, easy-to-view data, it's easier to calculate and adjust staffing to patient flow at different hours of the day and different days of the week, and this can also be done in advance or even on the fly. It's difficult to precisely measure all the ways that hospital and physician revenue is increased. However, it's easy to predict it in 3 specific improvements. One, the decrease in left without being seen is easy to measure. At some locations, it's been found that left without being seen patients tend to have better insurance status, so the decrease in loss of these customers immediately increases revenue for the hospital and physicians. 2, the increased patient flow and overall increase in productivity increases physician revenues also, and has been shown to more than offset the pay for the T5 area physician hours. Hospitals also have advertised this decreased waiting time and documented an increase in emergency department customers. Thank you so much for watching this video. Continue watching the remaining videos for more detailed information. All the subsequent videos are shorter, as they are focused on the individual details of the T5 system that we've discussed here. Feel free to contact me for any further questions that are not answered in the frequently asked questions section.